Professor Malcolm.
On the camera, leave the damn mobile aside. Dr. Elshab, can you listen to me? Can you see
Yes,
me?
sir. Yes, sir. I can listen to you. Yes, sir.
Yes, thank you. Now I'm about to start my surgery.
Okay. May I introduce you, sir? May I introduce you, sir, please?
Please, you're welcome, sir.
Bismillahirrahmanirrahim. It's a great honor to join with us tonight or today in this very important life surgery from India. Many thanks to Professor Malcolm Pestonji from India for being the host of this webinar and for making a live surgery transmission from our brothers in India. And many thanks to Endovision Company for being the sponsor of this live surgery. Thank you so much. Professor Malcolm, you are very welcome. We are waiting for you, sir, to start. Thank you so much.
Now, I will first take you to the CT scan and MRI, and I will show you what I'm planning over here. This patient is 47 years of age, 40 years of age. Last 7 years, he's been having severe unremitting pain in his left hand. I would like you to focus over here on this particular image where you can see my finger. You can see this is a C5, C6 disc. There's a huge disc over here, which is compressing the nerve root on the left-hand side. But if you see the same image in the CT scan over here, because this is at the corresponding cut, you will see it's a bony osteophyte. So this is the importance of having a CT scan cut and not depending only on an MRI. In the MRI, it looks like it's a black disc. In two cuts, you can see it over here very clearly. But the moment I again come back here, I'm coming back over here. And as you can see very nicely over here, there's a huge bony osteophyte, which is compressing the path of the nerve that is going out. So this patient is having a severe C5 nerve root compression, which is causing him severe pain. Now what I'm about to do is I'm about to mark the markings on the skin. So I will ask my assistant to focus on the C-arm. She's now going to show you the C-arm screen. And we are going to start taking our shoots. Okay?
Yes, sir.
Now we are going to take the first shoot. And I'm going to mark the midline. Mark the midline, please. Short. Okay, a little off. Okay, short, please. Yes, now this is the midline. I'm marking the midline. After I mark the midline, I want to mark the level of the disc, that is a C5, C6 disc. So where I see the first rib, that is a T1. The one above that is C7, C5, and C6. So I'm going to go on the C5, C6 disc, and I'm going to put a marker there. Shoot, please. I'm a little low. I'll just correct myself. Shoot, please. Yes, this is a C5, C6 disc. Can you see it? Huh?
Yes,
now,
sir.
but I don't want to do a central job. My job is not central. My osteophyte is in the foramen. So I need to come out onto the foramen. So I'm going to post myself here, coming a little out. And you can see, shoot please again. Yes, you can see the ball tip. The ball tip is exactly at where the V stops and the facet joint starts. Okay, so this is exactly where I want to reach. But to reach this, I have to mark my entries. Now, how do I mark my entries? You always mark your entry to the spinolaminar junction. You never mark it to that point where you want to operate. You want to mark it to the spinolaminar junction because you want to establish your reach. So I'm marking my lower facetal entry point. It will cut the lower facet and go right till the spinolaminar junction. Shoot, please. See. So I'm quite low. I'm going from below the lower C6 facet, almost at the C6, C7 junction and reaching the spinolaminar junction of the C4, C5, C6. Now I'm going to mark the next level from above. Shoot, please. Okay, see again this reaches but this is coming from slightly below the above facet, C5 facet. And it is coming to the spinolaminar junction. So now when I introduce my dilator and when I introduce my sheath, both will be able to reach the spinolaminar junction. Okay, and I wanted to come laterally also. So what I'm going to do is I'm going to now mark the lateral facetal line. Shoot, please. Yes, no, this is a little out. I'll come a little further out. Shoot, please. Yes, now I'm on the lateral facetal line. So I'm marking the lateral facetal line. Now, can you please focus here, Miss Shirley? So now she's going to show you what I've done the marking. Can you put on the OT? That's a little okay. It's a little dark, but yeah. Can you see over here? I have marked the midline. तुम्ही ती लाईट चालू करा प्लीज मला इकडे दाखवायचं जगाला ओके बंद करू ओके so I marked the midline I marked the lateral facetal line I marked my points to the spinolaminar junction which is exactly 3 centimeters apart. Give me a tape please. So if I take a tape I am exactly 3 centimeters apart. So my instruments will not get crowded. My instruments will be nice and comfortable. But I want to reach this point. This is the point I want to reach. So from my entry point here, I'm going to focus over here. From my entry point here, I'm going to focus over here. But at the same time, I'm going to strip till the spinolaminar junction. Okay? I'm going to follow the arc of the lamina. I'm going to come to the facet joint and I'm going to open up the facet joint. So we are going to start now. Can I please take a needle, please, so that I can mark myself carefully? And I can infiltrate some local with adrenaline. So what I'm going to do is, now I'm going to show you two things. One is when I mark my needle to the spinolaminar junction. Shoot, please. See, it's gone almost to the spinolaminar junction. Shoot, please. Yes. Next needle. Now I take a needle from here, from my marked point, and I go to the spinolaminar junction here, please. Shoot, please. See, both the needles meet on the disc surface. They're not deep. They're gone superficial. Don't worry. Okay, the neck is quite deep, so we are not worried about it. Now, that is one point that I want to reach. So this confirms that I can reach that point. But what I want to do is I want to make sure that I can reach the point where I want to open up the facet. So I'm going to target the facet now. Shoot, please. See, I've reached almost the facet. A little more adjustment and I'm on the facet. Shoot, please. Yep. Okay, so I've reached the facet. So from the outer, you can see by my needles, from the outer facetal line, I'm reaching the inner facetal line. I'm reaching the V where the two lamina meet. Okay, there is not much space there if you realize. There's quite a lot of shingling of the bones. Now we will confirm in lateral whether I'm at the C5, C6 space. So I'll ask Mr. John, can you please put the C-arm in lateral? And in the meanwhile, I'll start infiltrating some local anesthetic with adrenaline in it. So as to, for whatever sake it can give me some little decreased bleeding, I'll be grateful. Some more, please. देना मला लोड करून अरे रे पोरी मला लोकल दे रे adjust the C-arm, please. Make it 90. Make it 90 to the patient. Okay. Shoot, please. Oh, little down, little up, little up. Shoot, please. Yeah. Now, if you can rotate it, sir, can you mirror it and please rotate it? Yeah, rotate it right now. Make it 90. Yes, yes, please. Thank you, thank you, thank you. My needles are crossing each other. I'll correct the crossing. And here we are. Shoot, please. Yes, you can see both the needles are merging at the C5, C6 this space. Thoda niche le aur. Thoda. Yes, thank you. Shoot, please. Okay, okay, this is C7. No, we'll just come up a little so we can recalibrate ourselves. Shoot, please. 2, 3, 4, 5, 5, 6. Yeah, we are on the 5, 6, but we need to be a little more vertical in the 5, 6. So I'm going to do that. And shoot, please. Yeah, now can you see the vertical needle? Okay. And can you see the oblique needle? Both. Shoot, please. Yes, both are at C5, C6. That is a C2, C3, C4, C5, and C5, C6. So I'm at the C5, C6 this space. Okay, sir? This is the confirmation in lateral. And previously we confirmed in AP. Can you come in AP, please? Yeah, some of local. Shoot again. Yes, can you rotate the image, please? Make it straight. Make it straight, please. No, yeah, correct. Yes, so you can see the T1, C7, C6, and C6, C5. Okay. My lower needle is on the lamina of the C6, and the upper needle is crossing the lamina of C5 and coming to the junction, spinal lamina junction. Okay. So I'm quite happy with my positioning. I'm putting in some infiltration into the wound. Okay, thank you. And now can we take the C-arm back, and can you please focus here? Now I need a scissor and a forceps. We are going to make sure we don't carry any plastic with us into the wound. So I'm going to strip this a little bit. At the point of my cut onto the skin. Okay, Chico. Sorry, this is a little boring part of the surgery, but the most essential part, because we don't want to carry any plastic tissue into the wound while we are operating. Out with the needle. And this is the non-endoscopic part of the surgery. Okay, thank you. Because I've used 2 needles, I know my skin entry points. Now I'm going to enter first with the smaller wound, that is in the direction of, I'm cutting the nuchal membrane posteriorly in the direction of my entry. Okay, and it's a small 3 millimeter cut. Okay, now I'm going to take a dilator and I'm going to try and hit the spinous process below. Yes, I mean the lamina below. Thank you very much. Now I'll take a bigger cut with the working portal. Give me a stab knife, please. Now the stab knife is for the working portal. The working portal is here. And we need it laterally and a little medially. Again, in the direction of where we want to reach. Thank you. Can I have one more dilator and a series of dilators now? Okay. I want to make sure I've hit a bone. Yes. Give me the next dilator, please. Now I'm using a 7, 5, 7, 9, and 11. And finally, I think 13 millimeter dilator. Now, after having used the dilator, I'm going to start stripping tissues with the dilator itself. Okay. So we are going to bring in the C-arm and I'm going to show you what I'm doing with my dilators. Okay. This is the most harmless maneuver, but it helps lift the entire muscle bed up. Okay. Okay. Now, can we have a shoot, please? Shirley, can you please focus on the C-arm now? Thank you. My dear friends, I'm going to show you the C-arm image of what I've done. And I'm going to take a live shoot, though it's not good for me and my health. But I showed you the movement of my dilators. Can you see both my dilators are now focused exactly where I want them to be? Okay. And now, Mr. John, can you give me a live shoot? Okay. See, now I'm moving live. I'm moving live with my dilators. Okay. And I'm moving in both directions, clearing all tissue. Thank you. Okay. So now one more last shoot, please. Now, this shoot, why this shoot is important to me? Can you focus on me, please, Shali? Take the C-arm back. One is now I'm sure where I am. Take the C-arm back. I don't need the C-arm. Bring the camera trolley in front. And it has established my angle of working. Now I know at which angle I'm going to work. So this was very important for me. Now I'm going to connect my scope. Can I have a scope sheet now? Yeah, out comes this and in goes the scope sheet. Okay, thank you. Okay. Now, if you notice the scope sheet is on the C5 lamina. That's exactly where I want to be very honest. So I'm going to connect now. First, I'm going to do the wide balancing. Can I have a gauze piece, please? Thank you. Wide balancing is now complete. Scope. We are now making sure that our orientation is correct. Okay. And now I'll be connecting the fluid to the port. Can you hold this? And now we are going to be connecting our scopic view, and I hope you can enjoy a good scopic view today. Yeah, only movement of my hand now. Okay, or you can even focus on me a little bit. That's okay, no issues. Okay, now we're going to start the water pump, and we are going to come out with our tube of dilators. And as I come out with my tube of dilators, you can see that the water starts flowing. Initially, there's a little bit of blood. Can I have a mop? But then the water becomes nice and clear. Okay, and whatever little bleeding is there inside, we are going to go in and have a look at it. Okay. So, but before I proceed, before I fire, now I want my machia. I want to be comfortable. Two things you have to remember in the cervical spine. Do not fire until you see your tip. And do not fire if you're not on bone. Now, I want a C-arm, please. Now the C-arm is purpose of the C-arm. You'll ask me why. I'm getting a drag. I need some more. Yeah. Thank you. You can see there's a loose areolar tissue on the bone. You can see my plasma probe. This is by endovision. Bring the C-arm, please. I need to confirm on which lamina I am. Take the machine up, please. Bring the C-arm in front, please. Thank you. One shoot, please. Yeah, see, if you see now, my probe is on the lower lamina. So I have to go upwards towards the head, okay, which is to my 9 o'clock. Okay. So can you please start the plasma, please? 1 minute. Yeah, start. Yellow, please. No, wait for the C-arm. Don't take it back. It's very easy to get confused and get lost in the cervical spine and to make a mistake, and there's very thin phlegm there, nothing much to protect you if you go wrong. So It's better to be wise than to be sorry. Better to take proper regular CM shoots until you locate yourself properly onto the interlaminar space. Okay, so I'm not going to hurry up anything today. No heroics like of our last time. We are going to be very slow and gentle. We want our patient relieved and I as a relieved surgeon at the end of the day. Okay. Cervical spine is not a surgery where you hurry up. So we are going to go slowly and I'm going to correct myself. I'm going to try and become more and more vertical with my scopic view and at the same time push away tissue so that I can localize on the spinolaminar junction. Okay. And we can have some more better vision here. See, slowly everything will come in our view. We are creating a bed space by stripping away the tissues. Followed? Yeah, thank you. Can somebody stop please for a second? I just want my probe cleaned. You can see how nice the bone surface is being seen now. And I think this is the spinolaminar junction that I want to be at. Can somebody fire please for me? Yellow. Stop please. Okay, can the CM machine come in now? I think I've come to the spinolaminar junction that I want to be on. ही प्लास्टिकची पाईप खूप लांब आहे रे, तिला पाठीमागे खेच. काय करते? Yes, Mr. Siam, can you give me a shoot, please? See, now my probe is touching this is the spinolaminar junction I want to be on. And if I push further, that is the upper lamina count. Fire, please, a little bit. Yellow. 1 minute, huh? Okay. Fire, please. Fire. Stop, please. Now we will hit the lamina here. Okay, I can feel the bone. I can feel the bony edge, but I want to be a little more safer. Fire, please. One minute, please. I'll just fire, please. I'm clearing up the entire interlaminar space between two lamina. Slowly but surely, I'm exposing the superior lamina. We started from the inferior lamina. Stop, please. And we have come to the superior lamina now. Okay. Can you see? This is the interlaminar space. It's a lot of pipe ना मला खूप खेचते रे जरा लांब इकडून खेच ना जरा dragging on me, man. Thank you. Yeah, now I'm comfortable. Cervical spine is a bit of a headache because you need to keep the head up. 1 minute, please, before you take it back. Yeah, take one more shoot, please. Now push the machine in little front and shoot. And now you'll see that both my instruments will be on the upper lamina. See, both my instruments on the upper lamina. Okay, see, she'll show you. Yeah, both the instruments. Focus, please, zoom there. Both the instruments are now on the upper lamina. You followed? So I have identified the upper lamina. Can you fire yellow, please? Now, this is a wonderful thing about the Endovision plasma because it allows me to really strip away tissue in a very beautiful, gentle manner. Fire, please. And now I'm coming a little laterally. So that is where I intend to work. If I don't come laterally, then I don't know what I'm doing here. So now I'm going to come upon my V point, what we commonly call as a V point in the cervical spine surgery. Now the funny part here is, see, upper lamina, lower lamina. 1 minute, please hold your position. Okay, fire, please. Okay, lower lamina bone being stripped away. Okay, and I really need to go laterally. Okay, stop, please. Thank you. Okay, interlaminar space coming up, laminar bone coming up. This is the V junction coming up here. Okay. We need to strip this a little more. Fire, please. Thank you. Can I have a disc punch, please? A little bit of loose dissected tissue, which looks big, but is actually very small. Small amount, it can't be hardly seen. But when it disturbs you badly. And the problem is this tissue. This tissue is always there. And this tissue needs to be stripped slowly, slowly, slowly. Okay, now. Machine back. I don't need the machine anymore. Back machine, please. Thank you. Now, what I'm going to delineate and show you is, this is the superior edge of the inferior lamina. Okay, this is the central area. Okay. And this is the upper edge, lower edge of the upper lamina. This you are coming almost up here to the center interspinous zone. And as we go, and we'll do a little more stripping here. Okay, and push back these tissues a bit so that we have a little better vision as far as coming laterally is concerned. Now laterally, as I come down, You see, this is my V point. This is my V point. I need to strip a little tissue here, okay? So that I will, and from here now my facet joint starts. Here my facet joint is starting. Can you see this? This is the point of the facet. Okay, we need to open up this point for the root to be open. So I'll again take my 90 and then you give me a curved one, please. First I'll start with the 90. A little more stripping to be done. Okay, fire please, yellow. Now as I come down, you can see very nicely all the tissues. Can you now start firing the blue? Now we're going to do a little bit of coagulation and bleeding control. Okay. We want tissues to be demarcated. We want the facet joint to be demarcated. Yes, yes, yes. They're changing the fluid. And actually that helps me because it tells me where the bleeders are. Come on, fluid again, please. Yeah, thank you. You see, there are facetal arteries and they bleed. So you need to be careful. But you can see how I've opened up the facet joint also now. Okay. This is a facet joint which I've opened up. And this is a lamina which is coming down and forming the V over here. So we'll take one more shoot if you want to. I'll demarcate the V to you, satisfy you before I start with my burring process. But before I do that, I just want to strip some more of this tissue from the laminar edge so that not only is the root exposed adequately at the axilla, we expose it adequately at the shoulder also. So stripping the upper lamina is also important. So I'm stripping off all tissue from the upper lamina also. Okay, thank you. Now, can you bring the CM please once again? So we'll take a location shoot and then decide from where. See, according to me, this is the V, where the upper lamina, lower lamina both meet. Can you see this bone? I think I will try and reduce the light a bit. Yeah, as I reduce the light, you get a better picture. Okay. And now this is the lower lamina. This is the edge of the upper lamina. This is my V point. Now take a shoot, please. Let's confirm our V point. Bingo. Okay, here we are at the V point. So anything beyond the V point is a facet. So take the machine a little back, please, guys. Okay, now as I come down, this is the facet joint. Now, how much of the facet should I remove so that my root is free? That is a point of discussion. We will come to that slowly. Fire, please, blue. Yeah, I don't want any tissue tags troubling me when I'm burring. So some little fine cleaning up, fine pushing away of some tissues. Okay, thank you. Now I'm going to take a diamond tip burr. There is no role for a cutting burr in, according to me, at least in cervical spine surgery. This is a diamond tip burr. Can you please focus on me, Dr. Shirley, please? CM job is done now. This is a diamond tip burr. I'm going to use a diamond tip burr. तू मला फोकस कर ना, मला कशाला करायला सांगते? तू नाही करू शकत का माझ्यावर? तर कर. असं होते मला. Now this is my V point. This is the facet. I'm going to first burr a small part over here. Burr. One minute. Burr. Thank you. Okay. Now what I'm going to do, why I'm doing this? Because I don't want to keep on burring the facet without realizing where I'm going to end. So I want to burr only this much. Okay. Burr, please. Okay. Now this is the facetal end point. I don't want to go lateral than this unless I'm sure. I'll tell you why. This is John. Bring the C arm again now. I'm burring away the facet joint and I'm going upwards towards the lamina. Okay, towards the superior lamina, towards the superior laminar edge. Okay, guys. But one has to be very gentle because it's very thin here and the dura can easily open up. Stop 1 second. Okay, now 1 minute. थोड़ा वर घे ना मशीन यार मला क्राउड करतात तुम्ही. टेबल ड्रॉप करा थोडी. टेबल ड्रॉप करा. Drop the table a little bit so that they can see better. Thank you. अजून थोडी पण नंतर वर आणू. Now, why we had marked our point of drilling, end point of drilling was here. Correct? Take a shoot, please. Shoot, please. Surely when I'm taking a shoot, where are you supposed to be showing? Now you realize how far I've come out. So I don't have to go here, I have to go till here. Shoot, please. Yes. Now when I come here, you can see that I'm almost on the vertebral artery foramen. Now no osteophyte is going to go beyond this lateral limit. So this is the lateral limit of my burring. I should not go beyond this. Followed? Any more opening up of the facet joint beyond this point? Should please. No, this is a little medially. So we'll go a little laterally. Should please. Oh, my hands are coming on. Should please. Yeah. Now the scope is always behind. So sorry. Should please. Yeah. Shoot again. Yeah. Now you can see that I'm on the medial edge of the vertebral foramen. Now that is exactly the point where beyond which there is no osteophyte going to overlap. So I don't want to cut beyond that. Burr here, please. So I'm going to mark this as my end point of my lateral transgression of the facet joint. I'm not going to go beyond this point and disturb the facet further. So now as I open this up and as I go up medially, I'm going open towards the V. I'm opening up the V now. And now I'll be opening up the lamina. Now I've already stripped the bone so much, but you can see how much of a tissue cover there is still there. Okay. So you're going to halt 1 minute. And you're again going to use a kerosene punch, a disc punch. And we're going to use our plasma to remove some more tissue from here. I hope I can be heard by all of you and my voice is nice and clear today. Can I have the RF, please? Can you give me a curved one now? John, please connect number 2. Now, I prefer to use this curved plasma of Endovision when I'm on the lamina because it gives me proper control of where I want to put a spot on. See, this is where we have burred. This is where joined the V here. This is the lamina. This was the original V. This is where the spinous process came. Touch. Blue, please. This was the original spot where the V is. This is the facetal outer border, which I have demarcated. I will not cross this. But I'm going to drill only this much of the facet joint. But I want to strip the lamina better, because eventually I have to do a laminoforaminotomy both, no? Laminotomy and a foraminotomy. So the whole area has to merge up. So we are going to very nicely strip this tissue here in a guarded manner. Okay, thank you. See, now a little more on this side. Touch here, blue, please. See, this is the lower lamina. This is the lower facet joint. Okay, this is the SAP. This was the IAP. This is the facet joint in between. See, I'm burning the cartilage and the bone, and you can see how much it is overlapping. And this is the original V point. Okay, guys. So I hope I'm making myself nice and clear to you during this surgery. And you can see it's so bloodless. It's so efficiently being done. Okay. Thank you. Thank you so much. Now we'll again go back to our little burring. Okay. Boom. Machine back, please. Back machine, please. Table up. Up. Back machine, please. Thank you. Okay. Now we are going to start our burring a little more. Now this is a V point. Burr. Now the V point and the facet point both are now merging. Okay. So, bingo. This facet which I'm now burring will form part of the pedicle as we go up on the lamina. Now what I'm doing is I'm saucerizing the lamina rather than going deeper immediately. The reason being, very thin is the phlegm there. Don't want headache. Okay. And at the same time, now you see everything is opening up. There's no merging left. Now as I burr here, I'm burring the facet, that is IAP, and I'm starting to expose the SAP. You can see both developing very beautifully. Now this is why I told you, okay, it's very important to mark your lower limit, because you never know where your lower limit is subsequently. You tend to lose direction. Okay, so that should not happen to us. We want now, we are burring towards the lamina. This is towards the center. Okay. My root is flowing here. I'm burring the lower lamina. And I'm coming up on the laminar edge. See, now the lamina is becoming more and more evident to you. What was not evident is becoming very evident now. This was the original V. You can actually start seeing the dura also slowly. Everything becomes very evident as we burr away slowly. No pressure. You can see I'm very gently handling the burr. Literally zero pressure on it. And you can see the central spinal cord also opening up. You can see the V opening up. This is the amount of facet that I want to remove. I predetermined it. Slowly, I'm going about my job. I'm not hurrying it up. There's no room to hurry here. The slightest of hurry can create a big mess. You just keep on thinning the lamina. Thank you. Can we have a stop right now to our burring, and can I take a number 2 RF, please? Code 1. They're changing the fluid bottle. Thank you. And now I'll try and do a little bleeding control. Fire the blue, please. See, all the red marrow. I'm trying to control. I want a very pristine and a clear field when I do the final opening up. Endoscopy is all about clear vision. You can't compromise on it, friends. Patience is the aim of the game. And bleeding control, most important. You can see how the phlegm is separating out from the edge here. Okay. And I want to go here a little bit and do some more bleeding control. There is some bleeder somewhere which is troubling me. Okay, thank you. Oh, can I have a small kerosene? Can I have a dissector, please, first? You see how thin the drilling is? You can see the cervical cord. You can see the phlegm is retracted here. Same thing over here. See how thin it is? I'm just stripping here. This is the central dura over here. Okay. One minute. There is a bleeder somewhere. We have a bleeder somewhere here. So we're going to coagulate that. Can I have a covered. I want to know where the bleeder is coming and where it is troubling me. Fire, please. Blue. काम करते करे नवीन जो येलो टच का ब्लू Okay, thank you. Still, I'm not happy. Blue, please. Thank you. Yeah. Thank you. Now, can I have a small kerosene, please? I'm going to cut reverse along the laminar edge, open up the facet joint and try and expose our root slowly, slowly. As you see, I'm cutting more towards the upper lamina right now. So the upper facet is really thinned out. And this is the lower facet. And you can see the spinal myelin coming into your view nicely. तर जरा बीपी वर थोडं लक्ष ठेवा आता. Very vital. Can I have RF, please? At last, we are able to see the culprit bleeder. Fire, blue. Thank you. Yeah, we have a perceptible improvement in our visual acuity. You can see how nicely the cervical cord is opening up. And you can see how nicely we are chipping and chopping away, going laterally onto the root without actually even bothering to go towards the spinal cord as such. There's a lot of bone here which we can burr. So I'll prefer to do a little burring and thinning before I go further. So I'm going to place myself here away from this dura. Burr, please. Burr. As I'm going down along the lower pedicle, and facet joint. I'm thinning out my eventual cutting with the round jaw. Slowly making some extra space for myself. Thank you. I think this is nice. Let us see. Kerosene again, please. You can see how gently we can remove every piece of little bone. At the same time, go laterally, safely. Sir, मला bleeding control करा, please. BP किती आहे? Huh? छोटे oozers are troubling me. Fire blue, please. मला code वाला नवीन दे. ऑपरेट कसं करायचं? Comparison दे. You can see the exiting nerve root. भर दे मला. भर please. भर please. केळसंदे केळसंदे दुसरं कफ मागव ना, काहीतरी कर ना यार. मला कळत नाही तर मी एकदम सायकआउट होतो आता रे. मला बीपी एकदम कंट्रोल पाहिजे बाबू. मला कर्ड वाला दे. हे कर्ड नाही, मला कर्ड कॅरिसन दे आता. टच. मला उलट द्यायला पाहिजे होता चला. थँक्यू. अशा चुका करू नका यार. मला नवीन डायमंड टिप भर द्या. बर नवीन उघड, त्यापर्यंत तोच भर दे. बर काय कामाचं नाही आज. बर काय सप्तरे दर वेळा खेळत राहते. But come, kerosene, straight and small. You can see how tight the nerve root is. I have not stripped the outer membrane. I'm trying to remain outside the membrane continuously. And you can see how nicely we are opening up the nerve root. You can see the flow of the nerve root. You can see the pedicle also coming up. This is the pedicular wall on one side, and there's a pedicular wall below. You can see the dura over here. The root starts from here. I will be stripping all this and showing you the extent of the root which I've exposed. मला bleeding लय हैरान करते हैं कलर. And you can see how the root is becoming free as it is pulsating now, and it is becoming vascular. You can see a vascular flush coming into the root. Okay, but at the same time, we have not opened up its membrane. We have not disturbed it. Everything we're trying to do, without disturbing the nerve root. And we are going sufficiently lateral. I will be cutting this bone a little more now. Okay. And a little more of the central. You can see from here, the whole nerve root starts. The nerve root starts from here, and we have come right across laterally. Okay. We're going to go a little more. You can see the entire nerve root going here beautifully. And our end point is almost reached what we had initially marked. Can you see this outer part? Yeah, we are almost merging with the end point now, slowly but surely. We are removing enough. And this is the tip of the SAP. Can you see the tip of the SAP which has come out? And now you'll see the full root smoothly. See your root, the whole root is opened up. You can see how the myelin is. And you can see the osteophyte below also, which we'll show you now after some time. But first, give me some time to just clear up a little bit more. The slow process. Can't do anything in a hurry. I hope you guys are really enjoying yourself. as much as I am enjoying myself today. We have a small bleeder coming from the bone. Can I have the curved one, please? जरा बेटा जरा दोनों setting क्या? Put the setting on 2. Bring down the coagulation setting to 2. No, no, other one. Yes. Fire the blue. Thank you. Fire the blue. Fire the blue. Okay, fire the blue. Thank you. The bone is vascular over here as we are going out. And I'll be now reaching almost the end point of my dissection laterally. Your entire root is free. I'm just cleaning up the little bone shards to make sure I don't leave anything sharp over there. We don't want anything troubling this root. He's been troubled enough in life. Okay, I think I have substantially freed the root in every dimension. Okay. Now a little work to be done medially. We will do this little work here slowly and surely. We will now go towards the central canal, towards the laminectomy part of the whole surgery. Okay. Already you can see that the phlegm is retracted. And here I'm trying to remain again extra and open up here extra and a little more extra here. Now this point is very important for me, because axilla, shoulder of the root is here. Axilla of the root is going to be here. So now first I'm going to clear out the shoulder part, then I'm going to work towards the axillary part. And this is the root. So you can see how nicely we have opened up everything. Yeah, he's going to change the fluid. Again, we're going to have a bloody mess here, but please bear with me. Boom. Okay. See, you can see the entire myelin coming into your view. The cervical cord. Slowly the phlegm detaching itself. Oh, yes, the small phlegm. And this is the membrane. There's a small tear in the membrane that is covering the spinal cord. I've been trying to preserve that membrane so that I have less bleeding issues as far as possible. But you see, boom, membrane is open and the dura can be seen through it. Okay. या करा ना काय करायचंय करा. And now I'm opening up the central cervical cord little bit by little bit. Yes, you can see the central cervical cord nicely now. Thoda, thank you. Thank you, please. But I still need to work towards the axilla. So before I pursue there, I'll come back to the axilla a bit. Yep. This is a wonderful part about the caries and rounders by endovision is because if you see, I'm not really changing the position of my hand. I just change the position of the shaft. It's a rotatable shaft punch. I mean, sheer brilliance and sheer beautiful cutting power. So, see how badly things are adherent. At the point of the exit of the root, I can barely sneak in a small bite. I'm getting a lot of bleeding issues today. No, can I have a dissector, please? This is the worst part of everything. Is when you start mobilizing the root and you want to see. Yeah. Now I'm trying to mobilize the root. I'm going to go by the side of the root. It's quite tight. John. Oh, John Shett. जरा वाढवा कारण की इकडे दुसरा इलाज नाही माझ्याकडे. या प्लीज उद्या जरा नवीन बीपी प्रफ आणून ठेवा ओटी मध्ये. टच ब्लू. थांबा. हो असं नाही वाढवा तुम्ही पायाने नाही वाढवायचं. Can I have a curate again? Dissector, please. You see, I'm in the shoulder. I'm the axil of the root right now, and that is the root that is flowing down. There's a huge bone mass over there, which I can feel. I don't know whether I'll be able to retract it enough to show you, but let me try from this side. Maybe. Quite a huge bone mass, so even now the root is quite tight above it. Yeah. You can see how the tissues are slipping, how the root is slipping upon the bone. There's quite a thickened bone here. Can I have a kerosene, please? Can I have a burr, please? Burr, please. 1 minute. Yeah, burr. काय करतायत तुम्ही रे? Burr. Burr. Dissector. You can see the inferior communicating vein very nicely, which is supplying to the root. This is a vein here, and I'm trying to pull on that gently, very gently. There is a big osteophyte here. Not really allowing me much movement. Immense. Can I have a kerosene? Can we cut this a little? Yeah. I would have loved to mobilize this root further and show you, but I think that is pretty dangerous. So there's a huge osteophyte there. So, and our primary purpose of decompression has been achieved. So, really, I'm undercutting over here. Can I have the kerosene again, please? छोटे है ना. Dissector. Kind of the cramp edge, cramp level. You can see that the whole root is free. The membrane that was holding the root is now been opened up. Blue the curved. Touch please. Touch and go. 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 Touch. 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 I think we have done a decent job today. Garrison Chota. Let me just complete a few bites of the phlegm. Yeah. Can I have a drain ready? You can see the central cord nicely, the entire dural surface, the entire root in its path and glory. I'm sorry, we're having a little of patient's blood pressure has spiked a bit, so I beg your forgiveness. I can't show you a better and a clearer field. But I think this is decent enough. And I think we can call it a day today. I hope you, my friends, have enjoyed this surgery. Okay, you can see the beautiful root here, completely exposed. Can I have a dissector, please? 1 minute. I think I can show you the osteophyte also because we have stripped it now. So yeah, this is osteophyte, guys. Okay, this is a huge osteophyte. Yeah, you see I'm pushing into it, it doesn't go in. Yeah, I'm sorry. You can see the entire osteophyte. Okay, and there's nothing I can do over there about it. I know for a fact that I've decompressed the nerve very nicely. The nerve root is totally free. Okay. I'll have a small kerosene, please. And can I have a drain, please? Epidural hematoma is not an enjoyable thing in the cervical spine. Putting in a small drain is always a very nice thing to do. Sorry, there are small tags left here. I want to remove those. I don't want to leave them behind. Yeah, thank you. Can I have a disc punch? I hope you all are enjoying this. And yeah, I think I've removed everything. We've done a decent job. And thank you very much. Okay.
Okay, sir.
So
thank you.
Thank you, Dr. Elshab. It's been my honor and pleasure. I hope you enjoyed this surgery.
Yes,
you can see the entire spinal cord in all its beauty.
Yes, sir.
You can see the entire nerve root, which is free. I also showed you the dissector. I also showed you the osteophyte, which is anterior to the nerve root. Over here, you can see it from its shoulder. Yeah, this here is the osteophyte. I'll just retract all the tissues. Yes. Yes. See, this is the osteophyte over here. There is no soft disc over here. It's hard. You can see I'm pressing down. I'm pressing down with all my might. Nothing happens there. Okay. Yes. There's nothing to go into. And you can see from here that our nerve root is nice and free. We've gone nicely laterally far beyond the osteophyte. So we don't need to destabilize the spine further. This patient should be up and about tomorrow. I'm introducing a small drain to make sure that we don't have any epidural hematoma. Okay. So here goes in the drain. So just pinch it. Thank you. Yes. By right in the axilla. This is the last view we are having. Thank you. Thank you, everybody. Thank you very much. God bless you.
Thank you so much.
Out comes the scope.
Thank you so much. Thank you so much, Professor Malcolm Pestonji from India, for this marvelous presentation of this very important life surgery. Thank you so much, sir.
Thank you. Thank you, sir.
Thank you for your efforts, sir.
Thank you.
It was a great pleasure for us. Thank you so much. Finally, I would like to thank Professor Malcolm Pestonji from India for his marvelous presentation of this life surgery. Also, I would like to thank from my heart, from the bottom of my heart, Endovision Company and my dear friend, Dr. Baruch Tepkeski from South Korea for sponsoring this live surgery. Thank you so much. Hoping to see you again and again, and hoping to see you. Best wishes, sir. Thank you so much, sir.
Thank you. Thank you, sir. Thank you.
Thank you so much.
Cut.